inspiring Uganda.
Qualified, professional, and compassionate doctors talking real solutions to real health problems.
This message is from the Ministry of Health with support from partners.
Good evening, dear viewers and listeners. You are most welcome to this evening session, which is of very great health and social importance. Decompensated chronic liver disease. I'm Dr. Davis Akankwasa. I'm a medical officer in the Department of Medicine at Kayunga Regional Referral Hospital. Here with me, I have co-presenters.
My name is Dr. Nalumansi Anna, and I'm also a physician at Kayunga Regional Referral Hospital.
My name is Dr. Nakalema Irene. I'm a physician here at Kayunga Regional Referral. We are pleased for you to view us this evening.
In this session, we are going to discuss about decompensated chronic liver disease, what it is, the burden of the disease, and then the signs and symptoms of the disease.
Decompensated liver disease, or what in medical terms we call liver cirrhosis, is a serious health condition. It's a serious disease very few people actually know about, but we see it very commonly in the hospital setting especially. And in simple terms, it refers to, it's a condition of the liver, like in the, as the statement reads, liver. So it's a condition of the liver, and by the time we say decompensated liver cirrhosis, it means the liver has developed some scars. The liver has developed scars, and actually the liver is not able to do its normal functions it does in the body. So in simple terms, decompensated liver disease or liver cirrhosis is a permanently damaged liver as a result of scarring, severe scarring to what could have been normal tissue of the liver.
Thank you very much, Dr. Anne. Now we can listen from Dr. Nakalema Irene. Give us more highlight about the disease.
The disease is quite common, and we usually see a number of cases here in Kayunga Regional Referral. At least with our bed capacity in the internal medicine ward, in the medical ward, the diseases here we treat diseases that don't need surgery. And we have at least a capacity of around 30 patients and more per day. But among these, always we have at least 3 to 5 in a week. And at large in Uganda, the prevalence is quite high. We usually have about 17 in 100 patients.
Thank you very much, Dr. Irene. You have heard the definition from Dr. Anne, and you've also had more explanation from Dr. Irene Nakalema. Now, colleagues would like, members outside there, they would like to know people who are at risk of getting decompensated chronic liver disease. We can shed more light to them.
Like Dr. Irene has said, this is something that can be preventable. And there's a study that was carried out in Mulago Hospital about 2011, 2012. And results from that study actually showed that actually the top 3 risk factors means people who are at risk, who are more susceptible to developing a condition. So the risk factors that were found to be most common in our setting in Uganda, at least in Mulago Hospital, the number 1 risk factor was alcohol intake. Not just any alcohol intake, but excessive alcohol intake. And actually, of the 17% burden Dr. Irene had talked about, over 50% of those patients actually mentioned a history having consumed excessive amounts of alcohol. And someone would ask Dr. Akankwasa, what is optimal in terms of alcohol intake? So as a general maybe statement, we usually refer, it depends on the sex of a person, whether male or female. So for a man, we say optimal, we would say a man should not take more than 2 drinks per day. So you take your 2 drinks and that's it.
But
Then there are other risk factors that are not so common in our setting, but it's good to talk about them. People who are obese, obesity actually causes liver disease, and eventually it causes liver scarring. So if you have a high BMI, your doctor's probably told you have a high cholesterol level, please, you are at risk and you should try to do something about it. The other causes are a bit rare in our setting. There are conditions that we call autoimmune conditions, where your immune system, the defense system of the body, actually fights our own body. They're supposed to fight infections like viruses, bacteria, but in some people, they actually start fighting our own body. So sometimes they actually fight the liver. So there's what we call autoimmune hepatitis. So that can also, over time, it's something that occurs over time. It can also damage your liver and then your liver gets scars. But it's also rare. Other rare conditions, there are substances that are deposited in the liver. There's copper. Some people have some abnormalities in their genes where they don't deal with copper the right way in our body. So the copper is deposited in the liver, so that can also cause damage to the liver. Even iron can also deposit in the liver. There are so many other rare causes, but in our setting, we would like to focus on the alcohol, the viral causes, and also obesity.
You've heard briefly there are like 3 risk factors. We have diseases where body cells fail to recognize each other, and as well as they destroy one another, and that's where we have mostly the cells of the immune system, and those are the autoimmune related diseases. Then deposition of heavy metals in the body, which when not cleared, they can also cause our livers to have some disorder, like end up with being decompensated or failing.
I want to re-emphasize, you know, the reason we really want to create awareness with the public is because, like for hepatitis B, it's one of the main causes, like Dr. Anna said, but it's something that we can prevent. And really, like we are already discussing, this is one of the many diseases on the internal medicine ward or on the medical wards, which 80% of our conditions are chronic, and these are ones that you can prevent. The children that are up to 22 years have at least been vaccinated from it, but unfortunately, majority of us, the adults, have never gotten vaccination against it, and it's a disease that is very prevalent. The burden is very high in Uganda, Sudan, and northern Uganda, and eastern Uganda, now even in the central, because we are social with the movements. It's a very contagious disease, and this is something that someone can easily that we can easily prevent. Even the alcohol itself, someone can really, because most of the diseases that even this disease are diseases that are incurable. By the time you reach at the stage where your liver has become cirrhotic, sort of scarred, it has lost its normal functioning, and most of what we should do on our side, we should just improve your quality of care, but we can no longer reverse whatever changes have happened. Yet there was time and a chance for us to have prevented it, for the disease not to reach that extent.
Thank you very much, Dr. Irene. for all that explanation. Hope our viewers out there, you're listening attentively and you're able to pick a point from what is being discussed here. Next, we are going to discuss about how a patient with decompensated chronic liver disease, how he presents, the signs one can see, or how the person appears, so that one can easily seek immediate medical care in the right facility. Dear viewers, we are very grateful for all the wonderful time you've dedicated to our session here. So we are going for a short break. Do not go away. We are coming back. Thank you.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
MTN tusako hajaruna mbiru live in concert Friday nga mwenda August hajaruna mbiru huyo kusenda hotel Rockta nunga mwenda August mwisho ajatumia hajaruna mbiru live in concert VIP ya mtwalo 15 tukaba jigula kumomo ya mtwalo 10 matemeze ya milioni 3 nyiga kamunyenye emo mkaga 5 kamunyenye 20 kadara oba downloading ya momo app ogule ticket ku sente ntono nga 10 August Colin Hotel mukono ticket ya shinjo mtwalo gumu bo jigula ngo kosa momo jigula 15 VIP mtwalo 3 nga 10 August Maria Frema Saka shinje mtwalo 2 bo jigula ngo kosa momo ya mtwalo gumu VIP mtwalo 5 ate momo mtwalo 3 n'ekitundu bitegekedwa keti events olwone liwagirwa
MTN.
Together we're unstoppable.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from the break. Our viewers outside there, some or one might be wondering how a person with decompensated liver disease or a liver that has developed scars appears like. These are some of the symptoms. One, there can be yellowing of the eyes, which is a sign, which is an indicator that there is some function of the liver which has failed, and therefore the substance that is supposed to be removed from the blood has increased to a large amount, in that one can see it appear in the eyes, or can even be passing urine and other body mucous membranes, like in the genitalia, like in the vagina, in the mouth, and so forth and so forth. Another cause can be abdominal swelling. The abdomen can start swelling slowly, or gradually, up to the time one is able to seek the Holocaust, the healthcare services, and then is diagnosed of such a problem. My team could also could just reflect some more light about the appearances of a person with a decompensated liver. Dr. Irene may help us and give us more.
The condition has been is very most common in a young age group. That's why it is really of concern, and that's why it's one of the diseases we are discussing with you. The studies that have been done, but also here in our hospital, you know, this is Kayunga regional referral. We cover quite about 6 districts, so we receive patients from all different districts, and you find the age group of patients that really come with decompensated liver disease are quite young, about 38 and sometimes maybe up to the 40s. Now, these are the reproductive years, and really, and for such a condition that can be preventable, that's why we are really trying to discuss discuss it with you, so that you can be aware of it and maybe have a chance to prevent it. Now, usually by the time someone presents when the liver has scarred, that patient or that person has been with a risk for a number of years, and maybe they didn't get a chance to get it all away, and it kept doing injury to their liver, slowly but progressively. One of the most common causes is the alcohol. That means someone has been doing the alcohol for a number of years. The risk of who will get it earlier compared to another, for example, alcohol per se, I would just say that it has a predilection, it can select which any other organ to affect. But you find for some individuals, it will specifically go for the liver. And we may not know the other background risks that make it select a particular individual, but it is something that it's a modifiable risk factor. It's something that it can be done away with, and then someone can have many chances of having their liver normal. And then also if hepatitis B, by the time someone comes in with a liver that has now scarred, and that means it has lost its normal function, as Dr. Nalumansi already mentioned. That person has been with hepatitis, and maybe it went from the early stages of it to being chronic, and that it kept insulting or injuring their liver with time. It's unfortunate that majority of the patients, even here in Kayunga, are still between the peak ages, 38, 40s. But this is how patients will present. By the time the liver is beginning, it will start to form, it will lose its normal functioning. And so the protein, one of the functions of the liver is to produce what? Produce protein. And so if the protein is no longer being produced by such a liver, that's why and protein helps us to retain fluid within our blood vessels. And whenever the protein goes low, we shall get the fluid coming out around the tissues of the body. And so patients will usually present with body swelling, as Dr. Akankwasa said. So they will have swelling of their feet, and also because the system that's supposed there's also the system that the vessels that connect the liver to the spleen, usually the pressure in between there, what we call the portal veins, the portal vasculature, usually their pressures go high. And so patients usually will present with what we call portal hypertension. And so how do we know that as a sign? When they come to hospital, or they'll be forming fluid within their abdomen. And so they will come with abdominal swelling, and then we have the feet being swollen, and then the other presentation, because when the liver gets damaged, it affects also that pressure with the pressure between the vessels that are connecting one organ to another. For example, the liver to the spleen, usually the pressures go high, and so we shall have dilatation of some of the vessels also becoming abnormally bigger than usual, and these easily rupture and bleed. And those vessels that are most commonly affected are the ones we find in the esophagus and then also in the stomach. And so patients usually present with bleeding. They will present with vomiting of blood, and usually their stool, when you ask them, it will be black, because by the time blood someone bleeds from up here in the upper digestive part of the system tract, by the time the feces reach to the anal area, where they will have turned black. So they will present with the black stool. And then the other presentation will be still, because the liver is not functioning well, the patients can easily bleed. They easily bleed, because one of the functions of the liver is to help us with forming of what we call clotting factors. These are the ones that prevent someone from bleeding, and the ones that prevent bleeding when you cut yourself, or you get injured, or you get a surgical cut, so they're operating you. So there's a risk of easy bleeding when someone is getting decompensated liver disease. It's quite unfortunate, because by the time someone has reached this stage, we can only manage the cause, or whatever was the risk. If we can remove it, then we can prevent the liver from the progression, from it getting more damaged. But we may not really reverse at the stage where we find the patient. We may not reverse that damage that has already occurred. Yet there was a chance maybe to have gotten information and then made a better decision in trying to do away with the risk of whatever can cause the decompensation. Thank you so much. Maybe Dr. Nalumansi.
Maybe just to add, yeah, so for most of the patients actually we see the body swelling is quite a common presentation, but also in addition, Dr. Akankwasa had mentioned the liver helps to remove certain toxins from the body, and some of those, when the liver is damaged and cannot perform some of its functions, for example, removing some of those toxins, some of them can accumulate and actually go to the brain and other body areas. And actually some patients, we see them coming in with a bit of confusion, a bit of, there's what we call daytime sleepiness. Someone is very sleepy during the day, then maybe at night they are awake. Some of them come in drowsy, and even if it's so bad, we can actually even have patients come in when they're in coma. So in case you have any, you've observed someone or a relative or yourself with swelling, body swelling, the feet, the abdomen, someone is vomiting blood, when you go to the toilet, you're passing out black stools, you have a relative who gets on and off episodes of confusion, drowsiness, being sleepy during the day, please, you should seek some medical assistance, and then the patient is worked up for possible liver damage.
Thank you very much, Dr. Anne and Dr. Irene, for the wonderful explanation. Hope our audience outside there, you have heard and you will be able to seek immediate care in case you observe such signs on yourselves or on your people you stay with or take care of. Thank you very much, team. Thank you very much, viewers. Now we are going to announce next break. Please keep watching. Thank you.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show.
Uganda, are you ready to kick things up to the next level? The Uganda National Lottery brings you Sports Take 10. Predict the results of 10 football games and win big. With tickets at only 500 shillings, join the fun and make your predictions count with Sports Take 10. Sports Take 10, your ticket to football glory.
Uganda National Lottery. Dream, play, win. Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Ituba Uganda and regulated by the National Lotteries and Gaming Regulatory Board.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Dear viewers, you are most welcome back to this other part of the presentation about the compensated chronic liver disease. In this part, we are going to discuss what a doctor does when you reach the hospital. Once the person is feeling unwell and comes to the hospital, then the doctor has a few questions he poses to the patient. We'll ask how long the patient has been feeling unwell, and if there are any signs like yellowing of eyes, abdominal swelling, swelling of the limbs, the doctor will ask for how long. And then we take other relevant information about the lifestyle, because you know some of the risk factors are drinking, alcohol consumption, then exposure to some viral diseases like hepatitis B and C, as had already discussed, and then other immune-related disorders which can cause the liver to have scars or to become cirrhotic. Then after, the doctor will do the physical examination, which will guide on the diagnosis or the problem the patient has. Then the next step would be the investigations, which will help in the confirming the disease or ruling it out. Some of the tests are the abdominal ultrasound scan, which is requested The abdominal ultrasound scan will reveal details about the organs in the abdomen, including the liver, the size of the liver, and the nature of its nature will also be identified by the scan, and conclusions will be drawn whether the liver is cirrhotic or whether it has scarred. And then there are also other investigations which can be done, and those are the laboratory investigations as well. Please, Dr. Anne, you could enlighten more about the laboratory investigations.
Yes, thank you, Dr. Akankwasa. So usually we would like to look when a patient comes, like doctors told us, we'll take a history, what we call a history. We ask you some questions to ascertain the symptoms, how long they have been going on, the risk factors, what the possible causes of, if it's actually liver damage, the possible causes, and also questions to ask if you have developed some of the complications. And it's the same thing with the tests we do. When you come to the hospital, we shall first do tests to first confirm the diagnosis. And in the case for liver cirrhosis, we'll first take off some blood work. We'll take off blood work to check certain enzymes that come from the liver. We'll take off blood work to check how much protein. Remember, we said the liver makes protein, so we'll take off some blood work to check how much protein you have in your blood. We'll take off tests to check the kidneys. Doctor had earlier talked about patients who have this liver damage, bleed. So we'll take off blood to see how much blood you have in your, that's what we call the HB, to see if how much blood you have in your body. And then after, then still on the confirmation of the diagnosis, we'll do, there are certain scores we do based on some of that blood work that help us to come to the diagnosis. And also the scan can help us. Usually if the liver is scarred, like we have been saying, it usually appears smaller than the normal liver size. So on the scan, the radiographer is able to measure and then confirm, even the way it looks on the scan. So the scan is very important as well. So that's for diagnosis. Then we do tests to see, to determine complications. So the complications we have talked about already. We talked about bleeding. So we'll check your HB. The other complications, sometimes people who have liver disease can also get the kidneys damaged as well. So we'll take off the kidney function tests. Then the other tests we can do, because we talked about the vomiting of blood, passing blood either through the mouth or through the anal region. So we can do certain tests to see. We check inside the stomach or the food pipe for those blood vessels that become big when someone has liver cirrhosis, what we call endoscopy. So we do endoscopy. We can check your stool for blood to just confirm that someone is having some bleeding within the digestive system. And then other complications can be determined clinically on physical examination. For example, the brain complications where people get confused, whether they become comatose. Those ones you can see clinically. But the other tests, we'll do those ones that we have mentioned above. Then the other set of tests we do is to find the possible causes. Dr. Irene, maybe in Kayunga we're able to do hepatitis B screening. We can do hepatitis C, we can check for it. Hepatitis A is more complicated, but in some facilities it's able to be checked. Then there are more complex tests that we talked about, the autoimmune scenarios, those conditions that come as a result of deposition of copper, iron. Those ones are a bit more complex, but they still can be investigated on blood work. So your doctor will ask for all those, and then eventually will come to a conclusion.
You find, like for hepatitis C, we see it very common. First of all, it's transmitted via blood as the viral infection called hepatitis C. No, you find young teenagers who share sharps. Maybe they're already misusing drugs and they keep using sharps. So those are very high risk of getting hepatitis C. And then, but since it's also blood, it's transmitted through blood, you may find also maybe from your partner or any other blood contact that the patient may have had. For alcohol, obviously, like doctor said, we shall get to know that someone has had the risk from the history. As you're talking to your doctor or to your clinician who you have come to consult with, you're able to get to know how much you've been using, and then to know whether it's really the probable risk. And then we have other test scores that we use to know if the liver is already become scarred. And those ones we can use the blood tests, because the standard test would have been what we call a fibroscan. And that one is able to tell us if the tissue of the liver has now turned from being the normal to the scar tissue, which we are calling fibrosis. And so there's the fibroscan that can show us that. Then for the complication, like the bleeding, like we have said, whenever the liver becomes scarred, it's the pressures in between the blood vessels that supply it and that connect to the spleen. The pressures in between there go high. And one of the complications we saw is that the vessels that are in the blood vessels in the stomach and in the esophagus here up, they will become bigger, and they're abnormal blood vessels, so they easily bleed. And those ones we can easily get to know if they are bleeding by doing what we call an endoscope. An endoscope, we get a tube which has a camera, and we put it through the mouth, and we're able to take pictures to know who is already bleeding. The other complication, like we usually anticipate, whenever our tissues normally, whenever our cells, our normal organs turn from the normal to the abnormal, like now in this case we get fibrosis or scar tissue in the liver, there's a very high risk of getting cancer. And in this case, patient has very much risk of getting liver cancer. And so there is a blood test we do to usually screen to know who is at that stage of forming cancer. Also, the CT scan can also be able to help us to know if we're already having changes of cancer in the liver for that patient. The liver cancer bit is quite unfortunate, but these patients who have this chronic liver damage, we usually screen them every now and then, at least every 6 months. You come into the hospital, we're able to scan the liver just to catch it at the earliest time possible. Because once it actually passes a certain level, very little can be done to help the patient. So we usually screen, at least we check every 6 months. When you have scars in your liver, we do the scan every 6 months, and also that test to just make sure there is no cancer cell or cancer markers.
Thank you very much, Dr. Anne and Dr. Irene, for the wonderful explanation to the audience outside there. And you, the audience, you've heard, once you get any abnormal signs on your body, please, you rush to the nearest health facility so that you can get or can be guided in a right way, other than wasting time in other or alternative medicine practitioners who can make your condition worsen. Thank you very much.
This message is from the Ministry of Health with support from partners.
You are watching the DOCtalk show. You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back, dear viewers. Throughout the session, I hope you're able to note down some questions which you can post on our social media, and you get feedback as required. We are going to the last session, which is about treatment and prevention of chronic decompensated liver disease or liver cirrhosis, or in simple language, what you call liver scarring. Dr. Irene can discuss on the management.
For our patients who usually come with this condition, as much as we may not reverse some percentage of the liver damage that has already happened, but one thing we know, if you can identify the risk or whatever was the cause to the liver damage, to reach to that stage of getting the liver getting scarred, if you can identify the risk or the whatever caused it, we've already mentioned the most common causes, the alcohol. If you identify it's the alcohol, and you cease taking the alcohol, you give your chance. You give the liver a chance to regenerate. So it prevents it from progressing to getting more scars. And remember, like I've already said, whenever it reaches the being scarred, then there are high chances of it. If the risk is not removed, then there will be progression, more injury to those scars, and usually they become into abnormal cells, which forms a cancer. So the first part in management is to identify the risk and then take away the risk. And there you give your liver a chance to healing itself. The other second most common cause we said was the hepatitis, the viral hepatitis. So if we find it is hepatitis B, then you already at that stage you need to start your treatment. Not everyone who has hepatitis B will need treatment, but at the stage where the hepatitis B has caused decompensation, where the liver has reached the stage of being injured to the extent of getting scarred, such a person we have to treat for the hepatitis, the viral hepatitis B, and we use antivirals. I think I don't know whether some of you have noted, some of them we have drugs like tenofovir, and this is a long life treatment. We never stop the treatment. Whenever someone's liver has become injured and due to hepatitis B, and we discover it was the cause to the cirrhosis, to the scarring of their liver, getting fibrotic, we give it for life, because hepatitis B per se has no cure. Unlike hepatitis C, if we find the etiology or the risk to the scarring of the liver was because of hepatitis C, we give treatment, viral antivirals, drugs that treat the virus called hepatitis C, and for it is curable. Unlike hepatitis B, for those who have hepatitis B, we don't usually stop the medications. We give it for life, because already by the time it reached the point of your liver getting injured because of the hepatitis B, your immunity wasn't good enough to be able to suppress the virus from multiplying. There are many people who have hepatitis B, but it hasn't reached a point of multiplying at levels of even injuring their liver. For such patients, for such people who have hepatitis B, and we do what we call the viral load, and it will usually be undetected. In fact, you'll find that means their immunity is good enough and it has suppressed the virus from multiplying. And for such patients, we don't need to treat the hepatitis B. But for those who specifically come in with their liver has already become injured and it has reached to a point of getting scars, what we are calling now cirrhosis, the normal tissue is no longer having normal functioning of a normal liver. For such a person, we treat for life. And that means it's the drugs that are going to suppress the virus until it reaches to undetected levels. In fact, by 6 months, when we start on the drug and we do the viral load for such a patient, it will be undetected. If at all the drug is sensitive to the virus, the strain of virus that we are treating. And that gives a chance to such a patient to get reversal of their cirrhosis. That means we shall give a liver chance to get new liver cells forming, and so we prevent progression to even the stage of cancer.
Still on prevention, doctors talked about Hep B.
We are still on management. So for those that have fatty liver.
So fatty liver is really a lifestyle. We have to change our lifestyle. It could be going to do some exercise. There's a recommended amount of exercise someone is supposed to do per week, and a recommended amount of intensity of exercise that you're supposed to do per week. So if your BMI is above the normal, BMI is body mass index. We get your weight and height, and then we calculate it. So if your BMI is above the normal range, we usually recommend lifestyle change. So we do more exercise. We adopt what we call the Mediterranean diet, where you incorporate a lot of vegetables, fruits to your diet. And also just regular checks with the doctor to check on your cholesterol. But I think the most important thing is that what you eat and also being active. So that can help with the issue of obesity.
You know, doctor,
in that sense, yes.
Ideally, for each and every one of us, each person's height has the ideal weight it's supposed to what?
To handle.
Whenever you exceed that weight, that's when you get into an abnormal BMI, which doctor is talking about, the basal mass index. You can Google this. There's a formula for BMI on your calculators. Just get to know your height, and then you get to know your weight, then you enter those figures.
Yes.
Now, for those who are overweight, the BMI is above 25. Then person who has decompensated liver disease, and it's because of the fatty liver, you need to work at getting back to your ideal BMI. That means the ideal weight for your height.
Yes. Yeah.
So you calculate that with your doctor, and then you work towards that. Yeah. And as doctors said, the exercises are very important, and this becomes a lifestyle. It's not like you do a one-off of exercises. And as he has said, there are those that are quality exercises. You need to do both the endurance and the resistance exercise, where you like maybe swimming, that is involving the whole muscle groups, and skipping, so that is those are the endurance exercises. Then you need to do the resistance, which involve just the specific muscle groups. But this should be consistent. Even if it's brisk walking, you may say, for me, I cannot run, but you can do brisk walking maybe early morning. I usually prefer very morning hours. Either when the sun is not yet up or when the sun is down. Then check the doctor will check your lipid profile to know how much cholesterol you have. We have the bad cholesterol and the good one. And the bad one, usually we give treatment for it and we normalize that. And those that are good, the good cholesterols, we also have supplements like the omega-3 fatty fishy oil that can help to boost the good cholesterol to be normal, and also the bad cholesterol to come to normal. And the targets are lesser. We usually want to go lower than the normal. Yes. So then the other part of management
is in hospital. When patients come in with complications, still depending on the complication they have, if someone is vomiting blood, we still look within the digestive system and then close off those vessels doctor was talking about that have shunted blood towards the stomach and the food pipe. Then if someone has the fluid in their abdomen or swelling of the legs, we usually drain off the fluid. We suck out the fluid from the abdomen. There are certain medications we give that can help us drain off that fluid through the kidneys. And also if someone came in with confusion, still there are medications we give to help control that. So there's also the in-hospital management, which we will not maybe dwell so much about. But what doctor talked about was the most important things that we ourselves can change before. Maybe prevention.
So another thing about the other treatments, obviously the doctor will give you, because you will need to see a physician, and they will give you the other the treatments to support your liver, because it's no longer functioning as normal as another liver. We may need to, there are so many things that doctor will manage, which we may not discuss to your understanding. Yes, but there are some drugs that you may have to be on for most of your life, like the ones that reduce the what we call the portal hypertension. Please don't stop that drugs in case you have the disease already and the doctor has started on such a drug. Please, you need to continue with it. Need to continue with it. And then for prevention also, we have said one of the most common causes is the viral hepatitis. The viral hepatitis. This is one condition that can be preventable. Yeah. We are very lucky that at least for the young population up to the age, the 20 up to 22 years of age, at least they are able to incorporate hepatitis B vaccination at birth. The UNEPI formulas of the regimen they give for immunization when someone is still young. But for us who are above 22 years, we didn't get that chance of getting immunized when we were young. Now it is upon us as the population. Everyone who is above 22 years, you need to screen to see if you have hepatitis B or if you don't have it. And in case you have it, you know that your liver is at risk. Please, in case you don't have it, please go and get what? Vaccination. And usually, doctor, how many vaccines do we usually?
We get 3 doses. And I think maybe the other issue we usually get is people go for one, and either they are not consistent, they don't go back for the other 2, or they go at durations where, okay, the time they tell them to go back, they go back at a different time. So you go today, you go after a month, and then you go after 6 months. But you find some people either go for 2 and then stop there, or when they're supposed to go after a month, they go after 2 months, they go after 3 months, like at their own time. So that reduces the effectiveness of the immunization.
And doctor, we need to remember the hepatitis B is very, very contagious. So the only way you can prevent it, the standard way of preventing it is immunization.
That's the only way you can protect yourself.
That's the most standard way you can protect yourself.
And also your children, because this is something that can be passed on from mother to child. So if you are childbearing lady out there planning on maybe conceiving, getting pregnant, trust me, you don't want to pass down something like that to your child. So you go get screening. And even if they find when you have it, there are certain protocols in hospital that can help protect your baby and also start you on treatment.
And then the ones who already have who have already been exposed and you're already having the virus, the hepatitis B virus, we have already mentioned, and I want to repeat it, is that our immunity, the time when you got the virus, your immunity was good enough. I'm sure it was able to suppress it. But please, you still have to go and do the viral load, and in case it is detected, then you need to do serial checkup with your physician, so that you get to know if the viruses are increasing in number, because that puts you at risk of your liver being what? Injured. For those who have hepatitis B positive already, who are already exposed, we do serial checkups, like doctor mentioned it a bit, but we do serial checkups to make sure that the risk for the virus injuring your liver is very low. Usually we do markers like maybe every 6 months, or even every year, or sometimes every 2 years, depending on what level they find your viral load is at when they catch the disease.
For patients who have been diagnosed, actually the most common reason for admission we see is usually they run out of drugs and then they don't get a refill very soon. So if you're out there and you've been having this, were diagnosed with liver cirrhosis, please keep consistent on your drugs until your doctor tells you either to stop or to reduce the dose. Don't go off just because the medications are finished, because we see most times you come back because actually it was just because you missed a few doses or a few days of medication.
Thank you, doctors. Thank you very much for your wonderful presentation and explanation to the audience. Another way, preventive measure, you heard about alcohol consumption. So not consuming alcohol is very important. It protects you from the complication of a scarred liver. And then other immune-mediated problems of liver disease, they can also be rectified by visiting the physician as already been advised. Thank you very much for your audience. Stay blessed.
This message is from the Ministry of Health with support from partners.
UBC, inspiring Uganda.